Infertility and uterine fibroids. Uterine fibroids are common and frequently occurring diseases. They are benign smooth muscle tumors that grow on the uterus. The size, location, and number of fibroids determine whether they can cause infertility. For example, there are many different types of tumors on the uterus, leading to excessive menstrual bleeding and even prolonged bleeding. Not only does this prevent pregnancy, but it also causes anemia and affects overall health. Some people have few or small fibroids, and if these small fibroids grow outside the serosa, which is the outer layer of the uterus, they generally have little impact. They do not affect fertility or menstrual changes. However, if the fibroids grow beneath the endometrium, which is close to the uterine cavity, they can cause excessive bleeding, increased menstrual flow, and also lead to infertility, miscarriage, ectopic pregnancy, and biochemical pregnancy. It is important to pay attention to the size, number, and location of the fibroids, especially in the case of large uterine fibroids. Not only can they cause early miscarriage, but they can also lead to late miscarriage. Why? Because during pregnancy, as the embryo grows, hormone levels rise, and the fibroids also grow rapidly. They not only grow outward but also inward towards the uterine cavity, competing with the fetus for nutrients. Secondly, they compress the space for the baby's growth. Apart from causing late miscarriage, they can even lead to fetal deformities. Therefore, uterine fibroids must be treated first before getting pregnant. I have an article called The Dangers of Pregnancy with Fibroids, which emphasizes the importance of removing uterine fibroids before attempting to conceive. Diagnosis can be made through ultrasound. Full panoramic 4D color ultrasound, transvaginal ultrasound, and abdominal ultrasound can accurately determine the fibroids that have an impact on the body. Not only can they identify the number of uterine fibroids, but they can also determine their location. By relying solely on ultrasound, symptoms, and physical signs, there will be no misdiagnosis. In terms of treatment, many hospitals adopt open surgery or laparoscopy to remove fibroids, but often they cannot remove them completely. Some hospitals resort to excessive treatment by removing the uterus, which makes it impossible to bear children. Beijing Antai Hospital has a new technology called uterine fibroid cell apoptosis inducer. Under the guidance of ultrasound, the fibroid apoptosis inducer is injected into the fibroids, causing them to disappear quickly. Usually, fibroids can be completely eliminated in 7 days. Just like farming, when we spray weed killer, the weeds are removed, and the crops grow more vigorously. It neither affects future fertility nor changes the shape and position of the uterus. Just like farming, when we spray weed killer, the weeds are removed, and the crops grow more vigorously. It neither affects future fertility nor changes the shape and position of the uterus. It is the most advanced, scientific, and minimally invasive technique available. This technique is called ultra-minimally invasive uterine fibroid ablation. At Beijing Antai Hospital, we offer a contract-based treatment approach. If the presence of fibroids is still detected, referring to in situ fibroids, during the postoperative examination after 7 days, we will provide a full refund.